Important. Do not take any medicine during pregnancy without consulting a doctor. Pregnancy medicines commonly used. 1. Folic acid. Use. Essential in early pregnancy for proper development of the baby's brain and spinal cord. Very important during the first 3 months. 2. Iron tablets or ferrous sulfate. Use. To treat and prevent anemia or low blood levels. Helps reduce weakness and dizziness during pregnancy. 3. Calcium plus vitamin D. Use. For strengthening the bones of both mother and baby. 4. Paracetamol. Use. For fever and mild pain relief. Warning. Considered relatively safe in pregnancy, but should be taken after doctor's advice. 5. Doxylamine plus vitamin B6. Use. For nausea and vomiting or morning sickness during pregnancy. 6. Progesterone. Use. To support early pregnancy in certain medical conditions. Common medicines in general medical practice. 1. Paracetamol. Use. For fever and pain relief. 2. Ibuprofen. Use. For inflammation, joint pain, and headaches. Warning. Should not be taken on an empty stomach. 3. Amoxicillin. Use. Antibiotic used for throat, ear, chest, and urinary tract infections. 4. Metronidazole. Use. For stomach infections and dental infections. 5. Omeprazole. Use. For acidity, heartburn, and gastric ulcers. 6. Cetirizine. Use. For allergies, cold symptoms, and itching. 7. ORS or oral rehydration solution. Use. For dehydration due to diarrhea. 8. Salbutamol inhaler. Use. For asthma and breathing difficulties. 9. Metformin. Use. For controlling blood sugar in diabetes. 10. Amlodipine. Use. For high blood pressure. Important advice. Always take antibiotics with a doctor's prescription. Avoid self-medication during pregnancy. Do not stop blood pressure or diabetes medication without medical advice.